Welcome to the deep dive. We're tackling a really interesting topic today in veterinary medicine. Glycogen type vacuolar hepatopathy, VH for short.
Right.
Mostly in dogs, but sometimes cats too. Now that sounds like a bit of a mouthful, I know, but stick with us.
Yeah,
Even if you're just fascinated by how animal bodies work, understanding VH actually offers some pretty surprising insights.
exactly. And look, this isn't about suddenly diagnosing your own pet, obviously. It's more about, unpacking a specific liver change that vets see quite a bit.
Okay.
And what's really fascinating, I think, is that VH usually isn't the disease itself.
Yeah.
It's more like a signpost pointing to something else going on.
A signpost.
Yeah. So we'll dig into what this glycogen buildup in liver cells actually means, the surprisingly wide range of things that can cause it.
Right.
And also why a specific blood test result, high ALP, that's alkaline phosphatase, can be such a key, but sometimes puzzling indicator.
Okay, let's unpack that then. Vacuolar hepatopathy. So, at its core, it's when liver cells fill up with glycogen. That's like stored sugar, basically.
You got the core idea, yeah.
And it's generally something that can be reversed.
That's the definition, pretty much.
Yeah.
The reversible accumulation of glycogen inside hepatocytes, the liver cells. And you're right, it's usually a reflection of other things happening.
Okay.
Think of it like the liver just raising a flag saying, hey, look over here, something else is up.
Mm-hmm.
Now, there are some incredibly rare congenital conditions, where dogs are born with issues processing glycogen.
Ah, okay.
That would be a direct cause, but honestly, those are really the exception, not the rule.
So, if VH is usually signaling something else, what are the main culprits? The something else. Glycogen makes me think energy, sugars.
That's a very logical jump, and you're
Yeah.
spot on. One of the biggest drivers, maybe the biggest, is the influence of glucocorticoids.
Steroids.
Exactly, steroid hormones. And they can come from two main places, either given as medication, think prednisone, things like that,
Hmm.
or produced in excess by the dog's own body, like
Mhm.
we see in conditions such as hyperadrenocorticism.
Ah, Cushing's disease. I've definitely heard of that one.
That's the one.
So does that mean any kind of steroid treatment could potentially lead to this? Even like skin creams or eye drops that don't seem like a huge dose?
That's a really important question. And the research suggests how it's given does matter. Injectable or longer-acting forms, well, they tend to be linked with more significant VH compared to, say, oral or topical ones like those creams you mentioned.
Okay.
However, and this is where it gets interesting, even with pretty low doses or short courses of oral steroids, some individual dogs can still develop VH.
Really?
Yeah. It just highlights how different animals can be in their response. Some are just more sensitive, it seems.
Wow. Okay. So even seemingly minor stuff could contribute in some dogs. That really shows how sensitive the body can be. What about other things going on inside? You said it's often a sign of broader issues.
Exactly. Beyond direct steroid exposure, VH can also be triggered by the body's own responses to various stresses.
Like just general stress?
Yeah, the general stress response, the release of inflammatory signaling molecules, we call them cytokines, and also what we call acute phase responses. These happen when there's a systemic issue that's not primarily in the liver.
Okay, so like inflammation somewhere else.
Right. Significant inflammation anywhere in the body, or even cancer, actually.
Yeah.
Especially lymphoma seems to pop up alongside VH.
Right.
We also see a pretty common link between VH and gallbladder mucosalis in dogs.
Ah, yes. Gallbladder mucositis, they seem to come up a lot in different contexts.
They do. The exact connection there is still being, actively looked into, but the association is definitely there.
And you also mentioned atypical adrenal hyperplasia. Sounds like another hormone thing.
It is, yeah. Sometimes called sex hormone hyperplasia. It's another hormonal cause where the adrenal glands basically make too many sex hormone precursors. That can also lead to VH.
And are the signs different with that one?
Well, interestingly, the signs can sometimes be milder or less obvious than with classic Cushing's. Often one of the more consistent clues is just that persistently high ALP level on the blood work.
Just the ALP.
Often, yeah. And maybe just to round it out, we should mention chronic systemic illnesses in general and also certain medications like phenobarbital, which is used for seizures.
Right.
Those can sometimes contribute to VH too. So it really does act like a sort of check engine light for a whole range of internal stressors, doesn't it?
Yeah.
Hormones, inflammation, medications. The liver is really a sentinel organ.
It certainly seems like it. So with all these potential underlying causes, what might an owner actually notice if their dog has VH? Are there things to watch for at home?
Well, here's where it can be a bit tricky. A lot of dogs with VH are actually asymptomatic.
No signs at all.
Often no changes the owner would notice. However, if the VH is linked to that excess of glucocorticoids, either from meds or Cushing's,
Right.
then you might see some telltale signs. Things like drinking more, urinating more, being hungrier.
Okay, the classic steroid signs almost.
Exactly. Sometimes a pot-bellied look because of fat shifts and muscle changes.
Mm.
Maybe more panting, lethargy, even skin changes like thinning or bruising easily.
And if it's due to that atypical adrenal thing, what might owners see then?
Like we touched on, the signs there can be fewer and maybe less severe. Sometimes, really, the only hint might be that consistently high ALP showing up on routine blood tests.
Hmm.
It's important to remember, though, while VH itself doesn't usually cause obvious signs of, like, liver failure early on,
Okay.
severe and long-standing VH can eventually lead to liver dysfunction. But that's typically less common as the first thing you see.
Still, the thought of something going on without clear signs is a bit worrying for pet owners.
It absolutely is, and it highlights why regular checkups and blood work can be so valuable.
Yeah, definitely. It sounds like the lack of clear symptoms sometimes makes it tough to spot just by looking. Are there certain breeds that are more likely to get VH?
Yes, there are some breed connections, and these often link back to them being more likely to get those underlying conditions we talked about.
Ah, makes sense.
So, for example, breeds like miniature poodles, dachshunds, boxers, Boston Terriers,
Mm.
they have a higher risk of Cushing's disease, right?
Right.
So they're also more prone to getting that glucocorticoid-induced VH. Then you have Scottish Terriers.
Scotties.
Yeah, they have a predisposition to that sex hormone adrenal hyperplasia we mentioned, and they also tend to have high levels of fat in their blood, hyperlipidemia.
Okay, so double risk almost.
Kind of, yeah, and that high fat level can also contribute. And then other breeds like miniature schnauzers, Shetland sheepdogs, beagles, they're known to be prone to hyperlipidemia.
Right.
And in those dogs, we might actually see a mix of both glycogen and fat accumulating in the liver cells. So you see these genetic links influencing susceptibility to the things that cause VH.
Gotcha. So when a vet suspects VH, how do they actually diagnose it? Sounds like they need to rule out a lot of other liver stuff.
Absolutely. Diagnosis is really about putting together several pieces of the puzzle. And definitely considering other liver diseases that cause similar signs, like, an enlarged liver or that high ALP.
So what points towards VH specifically?
Well, one key indicator is often a really significant jump in ALP compared to the other main liver enzymes, like ALT and AST.
So ALP is way higher than the others.
Often, yes. Disproportionately high.
Yeah.
And we frequently see normal bilirubin levels, too, which measures jaundice. That pattern, high ALP, maybe normal ALTAST, normal bilirubin, is suggestive. But you can't hang your hat on it alone.
Okay.
It really underscores the need for a broader look.
And what about imaging, like ultrasounds? Can they give clues?
Oh, definitely. Ultrasound can be very helpful. In dogs with VH, the liver often looks hyperechoic.
Brighter.
Exactly. It looks brighter on the screen because it reflects more sound waves than usual. And sometimes you can see this sort of characteristic Swiss cheese pattern reflecting those changes inside the liver tissue.
Swiss cheese liver. Okay.
Yeah. And taking a small sample of cells with a needle cytology can also help. It often shows these enlarged liver cells with very pale or less dense cytoplasm. Pathologists call it rarefied cytoplasm.
Because of the glycogen.
Precisely. The glycogen pushes everything else aside and doesn't stain well, so the cells look washed out or empty.
So we've got the blood work patterns, the ultrasound look, maybe psychology. What else helps nail down the diagnosis?
Well, a comprehensive approach always includes a complete blood count, CBC, a full biochemistry panel, not just liver enzymes, and a urinalysis. These all give clues about those potential underlying conditions.
Right, looking for signs of Cushing's or inflammation or whatever else.
Exactly.
Yeah.
And depending on what the vet suspects, other specific lab tests might be needed. Things like ACTH response tests or urine cortisol to creatinine ratios to check adrenal function, maybe thyroid testing, checking triglyceride levels for that hyperlipidemia.
Okay.
Ultimately, though, for a definitive confirmation of VH, and maybe more importantly, to rule out other primary liver diseases, especially if the underlying cause isn't obvious,
Yeah.
a liver biopsy is often needed, taking a small piece of the actual tissue.
Right. That sounds like a bigger step.
Mm-hmm.
What are the pathologists actually looking for under the microscope with a biopsy?
So, under the microscope, the really telltale sign of VH is that obvious swelling, that ballooning of the hepatocytes, the liver cells,
Yeah.
because they're just packed with glycogen.
Okay.
And this swelling doesn't usually follow a specific pattern within the liver, like in certain zones. It can be kind of patchy or diffuse.
Right.
Pathologists might also see areas where the liver cells are actually degenerating. And interestingly, sometimes they see the body trying to make blood cells in the liver,
Mm-hmm.
which isn't its usual job in adults.
Ah,
Yeah, it's called extramedullary hematopoiesis. And sometimes that can actually be mistaken for inflammation if you're not careful.
wow. Okay. So once VH is diagnosed, what's the plan? How is it
Sure.
managed? Is there a treatment for the glycogen buildup itself?
That's a really crucial distinction to make because VH is typically a consequence, a sign of another problem.
Right, the signpost thing.
Exactly. The treatment focuses entirely on addressing that root cause.
So treat the other thing.
Precisely. For instance, if the VH is due to Cushing's, you treat the Cushing's with medication. If it's linked to, say, inflammatory bowel disease, the focus is on managing that inflammation, ideally trying to minimize steroid use if possible, which can be tricky.
Yeah, I can imagine.
If it's associated with cancer, well, treatment involves addressing the cancer. If it's an infection, you treat the infection. Low thyroid, you give thyroid supplements.
Okay.
Dietary changes become really important if there's high blood fat levels or pancreatitis involved. And in some specific cases, like tumors on the adrenal or pituitary glands, surgery might even be an option.
So it really hammers home that VH itself isn't the target. You're targeting the underlying driver.
You got it. Manage the underlying condition, and often the VH will improve or even resolve.
Okay. Are there any specific things vets need to be extra careful about when managing a dog that has VH? Any particular risks?
Yes, definitely some important points there. If a dog has pretty significant VH, it's generally best to try and avoid using other medications that are known to be potentially toxic to the liver,
Hmm.
if you can find alternatives.
Makes sense. Don't overload the liver more.
Right. Also, in patients who have both VH and that hyperlipidemia, the high fat levels,
Yeah.
you need to be particularly cautious with giving glucocorticoids, as they could potentially make both the liver changes and the high fats worse.
Ah, okay, good point.
And we also know that in some rarer cases, especially involving those sex hormone imbalances
Yeah.
and certain specific changes seen on the liver biopsy,
Mm-hmm.
there might be a slightly increased long-term risk of developing liver cancer, hepatocellular carcinoma.
Mm-hmm.
So ongoing monitoring is definitely important in those specific situations.
Okay, that's important to know.
But, and this is crucial to reiterate, in many, many cases, VH is asymptomatic, the dog feels fine, and it can potentially be reversed if that underlying cause is found and managed effectively.
That's good news. This has been incredibly insightful, really clarifying. So, just to recap the big picture, glycogen-type vacuolar hepatopathy, VH, in dogs mostly, is usually a sign that something else is happening systemically.
Right.
Steroids, whether given or internally produced, like with Cushing's, are a huge factor. But so are a whole range of other things: stress, inflammation, other illnesses, even some medications.
Yep, quite a list.
And that elevated ALP on the blood work, often way higher than other liver enzymes, can be a really key clue for vets, even if the dog seems perfectly fine otherwise.
Exactly right. And because it can be linked to so many different underlying conditions, getting an accurate veterinary diagnosis is just absolutely essential. That's what guides figuring out what's really going on and finding the right management plan for that specific animal.
It really makes you think, doesn't it? You know, given how many seemingly unrelated internal things can show up as this specific change in the liver, it kind of makes you wonder what other subtle or maybe disconnected symptoms in our animals might actually be linked to things we hadn't even considered.
That's a great point.
It really just underscores how important it is for us as owners to be observant and to communicate any concerns, even things that seem small, with our veterinarian.
Absolutely. Open communication is key.
Understanding how all these different body systems are interconnected is just so crucial, isn't it? For our awareness of their health and maybe even our own. Well, thanks for taking this deep dive with us today.
My pleasure. Great discussion.